Grief loss and palliative care nursing practice quiz. Question 1. A patient with severe vomiting for 3 days arrives at the emergency department. Which laboratory value should the nurse anticipate reviewing first to evaluate electrolyte imbalance? Option A, serum potassium. Option B, hemoglobin. Option C, platelet count. Option D, white blood cell count. The correct answer is option A. Serum potassium. Potassium acts like the electrical wiring of the body. Persistent vomiting can quickly drain this vital mineral, increasing the risk of dangerous cardiac rhythm changes that require immediate attention. Question 2. A nurse is caring for a patient receiving intravenous furosemide. Which assessment finding requires the most immediate follow-up? Option A, mild thirst. Option B, potassium level of 2.9 milliequivalent/L. Option C, urine output of 900 ml. Option D, weight loss of 1 pound. The correct answer is option B. Potassium level of 2.9 milliequivalent/L. A critically low potassium level can disrupt the heart's electrical activity. Question 3. A patient has a serum sodium level of 122 milliequivalent/L. Which symptom is most concerning? Option A, dry skin. Option B, muscle weakness. Option C, confusion and seizures. Option D, increased appetite. The correct answer is option C. Confusion and seizures. When sodium falls significantly, water shifts into brain cells and may cause neurological complications. Question 4. Which nursing intervention is most appropriate for a patient experiencing hypernatremia? Option A, restrict all fluids. Option B, administer sodium supplements. Option C, encourage salty snacks. Option D, monitor neurological status and hydration. The correct answer is option D. Monitor neurological status and hydration. Careful monitoring helps detect complications while guiding safe correction strategies. Question 5. A patient with diarrhea has developed hypokalemia. Which food selection should the nurse recommend? Option A, bananas. Option B, white rice. Option C, crackers. Option D, clear broth. The correct answer is option A. Bananas. Bananas are naturally rich in potassium and help replace electrolyte losses. Question 6. A nurse reviews arterial blood gas results showing pH 7.30 and bicarbonate 18 milliequivalent/L. Which imbalance is present? Option A, respiratory alkalosis. Option B, metabolic acidosis. Option C, respiratory acidosis. Option D, metabolic alkalosis. The correct answer is option B. Metabolic acidosis. Low bicarbonate with an acidic pH indicates metabolic acidosis. Question 7. A patient experiencing a panic attack begins rapid breathing. Which acid-base imbalance is most likely? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory alkalosis. Option D, respiratory acidosis. The correct answer is option C. Respiratory alkalosis. Rapid breathing removes carbon dioxide, shifting the body toward alkalinity. Question 8. A patient with chronic obstructive pulmonary disease retains carbon dioxide. Which acid-base disturbance should the nurse expect? Option A, metabolic alkalosis. Option B, metabolic acidosis. Option C, respiratory alkalosis. Option D, respiratory acidosis. The correct answer is option D. Respiratory acidosis. Carbon dioxide retention increases acidity within the bloodstream. Question 9. Which assessment finding is most consistent with fluid volume excess? Option A, crackles in the lungs. Option B, dry mucous membranes. Option C, poor skin turgor. Option D, decreased blood pressure. The correct answer is option A. Crackles in the lungs. Extra fluid often accumulates in the lungs and produces crackles. Question 10. A patient with dehydration is admitted after prolonged heat exposure. Which finding supports the diagnosis? Option A. Bounding pulse. Option B. Concentrated urine. Option C. Peripheral edema. Option D. Weight gain. The correct answer is option B. Concentrated urine. The kidneys conserve water by producing concentrated urine. Question 11. A nurse suspects hypocalcemia in a patient. Which manifestation supports this suspicion? Option A. Bradycardia. Option B. Lethargy. Option C. Muscle spasms. Option D. Flushed skin. The correct answer is option C. Muscle spasms. Low calcium increases neuromuscular excitability and can cause spasms. Question 12. A patient with fluid volume deficit suddenly develops tachycardia. What is the nurse's priority action? Option A. Offer a snack. Option B. Apply a heating pad. Option C. Encourage exercise. Option D. Assess blood pressure and perfusion. The correct answer is option D. Assess blood pressure and perfusion. A rapid heart rate may indicate compensation for reduced circulating volume. Question 13. Which patient is at greatest risk for hyperkalemia? Option A. A patient with kidney failure. Option B. A patient with seasonal allergies. Option C. A patient with cataracts. Option D. A patient with mild eczema. The correct answer is option A. A patient with kidney failure. Impaired kidneys may be unable to remove excess potassium effectively. Question 14. A patient receives excessive antacid therapy and develops a pH of 7.48. Which condition is most likely? Option A. Respiratory acidosis. Option B. Metabolic alkalosis. Option C. Metabolic acidosis. Option D. Respiratory alkalosis. The correct answer is option B. Metabolic alkalosis. Excess alkaline substances can produce metabolic alkalosis. Question 15. A nurse is teaching about fluid balance. Which statement by the patient indicates understanding? Option A. Fluid shifts affect only blood pressure. Option B. Electrolytes are important only during illness. Option C. Water and electrolytes work together to maintain cellular function. Option D. Sodium is the only electrolyte that matters. The correct answer is option C. Water and electrolytes work together to maintain cellular function. Water and electrolytes function together to support normal cellular activity.